Oh, hi, everybody. Welcome to another GWCIM podcast. We have a wonderful guest today. She's going to talk about cannabis and lots of work that she's doing. So, without further ado, going to jump right in. I'm Dr. Kogan, Medical Director of the Center and the co-host of this podcast. And today we're meeting with Laura Barrett, MBA, BSN, registered nurse, also known as Nurse Lara. Laura is founder and executive director of the National Clinical Director Consortium, owner and operator of Ask Nurse Laura, and on the board of multiple nonprofits, including the Connor Sheffield Foundation. Laura focuses on providing education on cannabis and psychedelic medicine options to individuals, small groups, or large conference auditoriums. Additionally, she's teaching faculty at the University of Maryland School of Pharmacy for the Masters of Cannabis Science and Therapeutics program. Yes, there is such a thing, and we'll talk about that, I'm sure, where she developed content for the psychedelic elective course. She has worked in each of the plant touching cannabis fields, from growing, processing, and opening dispensaries, as well as sales, marketing, and compliance. She prioritizes knowing the law, regulations, reviewing the science, and gathering patient data to integrate this data into consumable presentations to support public health. That's a lot of introduction, and we can go all kinds of ways here. But I think let's start with this. You live local, right? You're here in DMV area. Tell us sort of what's going on in our own area regarding psychedelics and cannabis. Let's start with that.
Thank you so much for reading my bio. It's so hard. I mean, you have so many things that you have done too. It's like it's humbling to hear some of the things you've done put all together. But in the past 10 years, a lot has happened in Maryland, and I've kind of expanded across the country in DC. Lots of things have happened, and so one of the things that I worked on a year ago, the last legislative session in Maryland, I
Mm-hmm.
worked with a group called Marylanders for Beneficial Psychedelics. And we spent time in Annapolis advocating for a bill. We sponsored a bill for creating a task force in Maryland for responsible use of psychedelic medicine. And the bill passed.
Mm-hmm.
Now we are, or not we, they, the government is staffing this task force, which I did thankfully just get appointed to by the governor. So we haven't had our first meeting yet, but we're going to be meeting. The task force has 17 spots representing policy. There's a legislator on it, there's a police member on it, Indigenous American on it. Like there's people from all different aspects of plant medicine, fungi, and it should be really helpful. It's being housed under the Maryland Cannabis Administration.
Mm-hmm.
Government always needs a home to put somebody to operationalize a group, and thankfully Will Tilburg agreed and offered to host the task force. And so we'll see what happens. Right now, it's still all illegal, even though some people are doing some work in the psychedelic
Mm-hmm.
space. We do have some, like ketamine clinics, things like that, and groups. I work with a group in Baltimore that does ketamine assisted psychotherapy and does some microdose psilocybin coaching, but doesn't actually provide any of that medicine because in Maryland, it's not legal to do so.
Yeah, I got this funny message from Facebook a couple of days ago. Somebody connected me to somebody else saying, "Oh, why don't you start a study on amanita?" Apparently, combination of amanita and some vitamins have been shown to be highly effective for ADHD. And the person was like, "Yeah, but it's legal, right? You can just start doing the study tomorrow and get the grant from NIH." And I'm like, "Yeah, people, you really don't understand anything that's happening." So I kind of wrote a big message back. People got really upset that, oh, how come such an effective method? This patient of mine, this was psychologist actually, this patient of mine got off of the stimulants. So what do you think? I mean, how far are we from legalization of psychedelics? And I'm not talking about cannabis or ketamine. I mean, those are legal substances, and at least in our state, ketamine is legal everywhere. I'm talking, of course, psychedelic mushrooms particularly, but also, things like maybe even LSD and MDMA and other things.
Yes, I think when we look at a lot of other states are moving forward with psilocybin and with Hopkins really active in research on psilocybin, I think this is just my personal opinion, not any organization opinion. I think it'll be psilocybin first. Like I think that's where we'll go first. I don't think it'll happen. This task force, for example, nothing's going to happen before the task force has time to meet and make some recommendations. And the task force and this group that not everyone is on the task force have a lot of desires for lots of different psychedelic options, not just psilocybin, because some different, they all work so differently and for different things, whether it's treatment resistant depression or cluster headaches. I learned so much in working with this group about how some different psychedelics help with cluster headaches where nothing else helps. So it's been really interesting. And really, even in the space of functional mushrooms, I wish we had a little bit more regulation. So many people don't like it when I say that, but I'm a fan of, I like to know that things are regulated and lab tested and I can trust the product that I'm going to put in my body. So there's so many like mushroom cacaos, mushroom coffees, mushroom supplements. And I think and those are without, not magic mushroom, not psilocybin, just functional mushrooms. I think there's a lot of benefit in all of these things. The more that I learn, even though, my living is made off of my work in cannabis over the past 10 years. But in the past few years, the integration between cannabinoid medicine and psychedelic, particularly mushroom and entheogenic medicine, has been really coming to the forefront, because for so many people, just that tiny little bit, just microdosing can really help to make lifelong changes where you don't need the crutch. So often with cannabis, I think it's medicine, but it's like a crutch where some of the psychedelic medicine can actually, open up that neuroplasticity, let you do the work faster than some traditional therapies, and then move forward. I think it's so beautiful. So I think it will come. I don't think it's going to be in the next year. It's probably a couple of years out, but it will come. And DC, a lot of people are going to DC because DC has a little bit more of a legal option.
Well, DC decriminalized it in 2019. I actually was one of the people engaged in that law process. But it's not legalization, it's decriminalization. So it's a little bit different. It basically allows people to use it without being afraid to be punished. But there's still no legal process of purchasing it. Like when you purchase it, it's still illegal to buy it and sell it. So it's still weird, and it's still kind of unregulated, unfortunately. So, we have just in our backyard in Baltimore, we have this profoundly, amazing institute, the Hopkins Institute for Psychedelic Studies. So anybody from there involved on this panel? Because there's such an expertise in there.
Yes, I can't, it wasn't one of my friends from like Ryan Vandry, Justin Strickland. I've known them for a long time, but yes, there is someone from Hopkins from the psychedelic study from their institute on the panel. They worked with us a little bit alongside of the group that was working on this bill. So really important. And also Andy Coop, the pharmacist and leader in the University of Maryland program, psychedelic expert, is also he's representing University of Maryland.
Well, good. That's good. That's great. So sounds like the process have started. That's wonderful. So, and I know you're starting a study on the cannabis. So let's talk about that. So what is it about?
Yes. So similar to wanting psychedelic research early on, when I was starting to work more independently in cannabis medicine, I went back to my peers at Hopkins. So I was at Hopkins when I was invited to come and help open a grow facility in Maryland
Hmm.
right when they were just starting medical. And I was working at Hopkins, and I had such a stigma against cannabis that I was really concerned about even being a part of a cannabis license. And so I went to my peers at Hopkins in research on cannabis and did some shadowing and just spent some time asking questions on the record, off the record, and kind of got to know them. And then, as we go to all of these cannabis conferences, you see the same people over and over presenting their research. And so when the nonprofit, the Connor Sheffield Foundation, was forming, which it's probably a longer story than we have time for, but that the person that it's named after, Connor Sheffield, who's now an adult, when he was a kid, still has, but had a very rare stomach motility disorder. And the only thing that worked was cannabis. At the time, he was using mostly like hemp CBD products, but it became a really big challenge because he didn't have access to the medicine, and he had to leave school property to get his medicine for his parents to administer it. There were so many risks. So that group started something called Connor's Courage and started lobbying in Annapolis for a bill to allow kids to use cannabinoids on campus in school, administered by the nurse. That bill did get passed, that did get instituted. Now, if there is a medical reason and it's non-smokable, very monitored, parents can get access to the cannabinoids for some of these serious medical disorders, so that kids can go to school and not have to miss half the day leaving campus just to get their cannabis.
Wait. That's a really important point. So let's hold off a second. So before we get off this, so if the kid has the recommendation from a prescribing from a physician, has the card, got the right cannabis product, the school will have to administer it. Is that what I'm hearing?
Yes. It is through the school nurse. You have to have some paperwork. It's all about paperwork, right?
Of course.
Signed and labels and again, non-smokable.
So can a school opt out? Can a school say no to this?
It's really interesting. So I think some schools have tried, and I don't think it's very active in many counties. However, it goes through, like, there's the school, but there's the school nurses is a whole organization. So it's through the school nurse association, and nurses have a responsibility to take care of people ethically, including administering cannabinoids.
Right.
That's a whole other big part of what I'm really active in right now, is encouraging nurses. So a year ago, September 27th, 2023, the American Nurses Association approved a specialty of cannabis nursing. So soon, we're going to have like a board certification as cannabis nurse specialist. And I've been spending a lot of time trying to provide education in academia and in health organizations like Hopkins and University of Maryland, that like nurses, we're allowed to talk about, we're allowed to touch, we're allowed to, and we're responsible ethically to help people with this medicine.
So I have not heard this anywhere. So I have not heard any other state mandating something like this. Because, like, for example, if the patient with a cannabis recommendation and a home product goes to the hospital, and this situation happens every day, a lot of hospitals in DMV area will refuse to administer it. And, I've had calls from lawyers suing the hospitals. I've seen, and it hasn't changed anything, because the hospital, when the hospitals say, forget it, we're not doing this, the patients have nothing, like, there's no option. They basically, nobody tries to push through this. And that's a very common scenario. And some states have tried to mandate this. Some states failed, I think, to mandate, and it's basically kind of left to the preview of each individual hospital administration to make a decision. Obviously, I'm only talking about states where cannabis has been legalized, but this is quite specific. So why can't we simply try to push the law in Maryland that will say hospital must administer?
So actually, this organization, the Connor Sheffield Foundation, after we got the school cannabis policy passed and in some place enacted, then we moved on to entering a bill for the past couple of years. We did write a bill. There's an organization called the Cannabis Nurses Network that created a law called Ryan's Law that they got passed in California.
Mm-hmm.
They never actually had a policy implemented yet. So they've been trying, and I work with them as well, not as much right now, but to move that law forward in other states. So we took that as a baseline, worked with them at first, and then modified to meet like the Maryland needs, and brought it to Annapolis. And it did not get voted down, but it did not ever get to a vote. So it didn't pass. Our
Mm-hmm.
only opposition was the Maryland Hospital Association.
Sure.
And so then we worked offline with the hospital association, talked about the concerns, and the whole idea is when you're trying to shove something down their throat, even more so, they're going to reject it. So we worked together. I particularly worked offline, like back and forth with their policy person at MHA, and we came up with a policy that all of the stakeholders passed
Mm-hmm.
in Maryland.
Mm-hmm.
That also was about a year ago, November, and they haven't wanted to publicly announce that there is this policy. It is not required, it's optional. Hospitals
Yeah.
can choose. And I just had a conversation last week with them again, saying, I just want you to know it's been a minute. It's time. I'm going to start talking about this more. And so more questions are going to be asked. And will you please, put me in there? Let me talk to some of these leaders, especially at like some of the local hospitals. Like I live not too far from Hopkins Howard Medical Center. And in places like University of Maryland, where we have a cannabis program, we have cannabis experts, and yet you still can't bring your cannabis to the hospital. So I'm trying to reinvigorate that conversation, and I'm waiting still for the last minute
Mm-hmm.
that says I'm allowed to share the policy, because again, it's a Maryland Hospital Association stakeholder approved inpatient medical cannabis policy that essentially is like a bring your own med. It has to be labeled. It can't be smokable. There are rules. It has to be medical.
Right, right, of course.
Really?
But that's the problem. So if it's optional, then most hospitals will potentially will vote it down. They're going to say we don't want this.
Yeah.
We dealt with this in GW Hospital about 12 years ago, I want to say. And the idea was very simple. Initial idea, well, yeah, so it has to be non-smokable. That's just across the board. And I think that's actually the right thing to do. Like, I wouldn't even want to consider somebody smoking in a hospital. I mean, create all kinds of,
Oxygen and with
yeah, it's just a lot of
things.
other problems. So we created this policy that we will never recommend cannabis inside a hospital, even if I get consulted for someone. We wouldn't do that, but we would allow patients to take a product if it's appropriately labeled and the patient has a card. And basically, it gets locked into a standard controlled substance cabinet for the patient, just like you would prescribe narcotics of some sort, like a Percocet. It would be the same way that the nurse would administer. And we haven't had a lot of problems. We've had few situations where there was some tension around the issue of patient wanted it to take some extra doses, saying, "Oh, I have a control over this at home," but then the hospitals would say, "No, you have a certain parameters you have to take it with. Like, we're not gonna, like, we can't get around this." And so this would be true for any medication. But all in all, I think it's worked okay. We haven't had a lot of problems so far. Sometimes I get involved when there's a concern when the patients bring non-medical product and
Mhm.
don't know what they're looking at. So sometimes we have to sort of figure out what the product is. And a few times we had situations that were more interesting where patients would ask for CBD-based product to be brought without a card. And that's theoretically easier, right? Because they can go to Whole Foods across the street and buy one. But it's also not that easy because you don't actually, frankly, know exactly what they're getting. So,
Right. Then we don't have a label. Then we don't necessarily have third-party testing.
exactly,
Definitely
exactly. Yeah. So nothing is easy.
easier, but not easy. Yes.
Yeah.
I'm also working with Brightview
Mhm.
Assisted Living right now.
Yeah.
They operate in 8 states, and all of the states that they operate in the Mid-Atlantic region up and down the East Coast have medical cannabis programs, and almost all of them have adult use cannabis or decriminalized cannabis.
Mhm.
We're working on implementing policy.
Well, that's already done. So about 6 years ago, American Directors Association, which oversees all of the assisted living and all the nursing homes, basically passed the straight law, the internal law saying every nursing home under our, if you're in the network for ADA, you have to allow, and you have to have a law, you have to have a written procedures in place, you have to, and they very positive language. So they basically saying patients on it, you have to support it. Like you have no, and there's been actually a couple of lawsuits in the country when they didn't follow, and a nursing home got sued. Now it's a little different from assisted living because assisted living not necessarily fall under CMS as much as nursing homes, but it should be a lot easier in assisted livings to get all this done because they regulate it a bit less and it's less stringent. The nursing homes process was, I was quite surprised when that happened. I think they realizing that it's such an effective treatment for so many things that they wanted it.
And for palliative care.
Exactly.
I
Yeah.
need to look that up. That'd be interesting to
Yeah,
have.
I'll send you a link. I'll send you a link. It's pretty straightforward language, very, very positive language, and basically can just use that to say, look, if American Director Association strongly advocates for it, all of, I'm sure Brightwood is part of that.
Yes, well, and Brightview, they hired
Right.
me. They want it. Like they're just trying to figure out how to get everybody trained and make everybody comfortable. And they care so much that they gave me like a whole team of senior level leadership to work with, like the senior pharmacy director, the senior compliance, a lawyer, just so that we can make sure that everybody's comfortable. And then mostly it's so sad. I see this in nursing, I see it in pharmacy, maybe less in pharmacy. Personal stigma impacts how we talk to people,
Yeah.
which is just really interesting because, again, I come from the other side. I am not the person who has been a cannabis fan my whole life and now I'm just making money off of it.
Mhm.
I was fully against, had such a stigma, and now I'm like, yeah, I mean, I need to make some money, but I do this advocacy work is all on my own time. It's all for free because it's so important to me, as I've heard and worked with so many patients, because I do one-on-one consultations also, and I've seen how lives have been changed. And in particular, someone like Connor Sheffield, where
Mhm.
he's afraid to go to the hospital, he's afraid to have surgery
Right.
because he doesn't use opioids. None of these other medications work for him. Cannabis is what works. And if he goes and he can't use it, that's a concern. And
Interesting. I have exactly the same patient who's a bit older, so we don't have a problem, and most hospitals he's been to allow him to take it. But yeah, it's fascinating, and it's really sad that there is still so much resistance across the board.
Mhm.
Although I think we're entering era where resistance is changing towards more, how do we do this right, rather than we're just not doing it.
Yeah, I
So
think
yeah.
that's helpful. So
Right.
back to our research studies. So we wanted to, originally we were raising money. The foundation was raising money to do research, and
Mhm.
we were talking to our friends at Hopkins, and it costs way too much money and takes way too much time to try to do something in that really
Yeah.
formal way, particularly in cannabis. And this was before
Yeah.
the last federal level regulation changed about research and cannabis. So we decided to go independent and just try to get a study published. So
Mhm.
we wrote up a case, we presented it to an IRB, we got approved,
Mhm.
and we're doing an observational study on post-traumatic stress disorder symptoms and utilizing cannabis to relieve those symptoms. We're trying to get 1,000 patients from across the country. The only requirement really is that you are over 21 and that you're using cannabis purchased from a legal dispensary in your state. And
Does it have to be medical, or it can be any?
It doesn't have to be
Doesn't
medical.
have to
It
be.
has
So
to
you
be
just
legal.
patient just have to have some kind of trauma and PTSD like symptoms, and you're simply asking them questions and collecting the data, right?
Yes, and it's just 3 surveys. And we're using the app. I'm not sure if you've heard of this app called Tetragram. So my friend Otha Smith, super entrepreneur, high tech guy,
Mm-hmm.
many years ago now. I think it's like 5 years old. And I know there are other cannabis tracking apps, but this app is a free app for patients, and you can scan barcodes on the products that have a barcode. Many of the growers, processors have opted in, and so it pulls up all the information about the product that you're using, and then you can kind of journal in there, and there's a lot of like canned text fields. So one of the things I worked most recently when I was at Hopkins, I worked on the electronic health record on Epic.
Mm-hmm.
And
Mm-hmm.
I learned a lot about how we need like canned text rather than all these free text fields to be able to collect data and do something with it.
Mm-hmm.
And so gratefully, Tetragram is that way. There's a lot of fields that we can pull data from, sort by state, which patients are using which products for, how's it helping, which levels of cannabinoids are helping. And so all people have to do is, yeah, just sign up through, and I can put the link in the
Yeah,
chat.
so I'll make sure that I get links to all of those things you're talking about. Obviously, to your study, to the app. I want to make sure that our viewers can review all of this, and also would be very good for anybody who's watching this, and if you have a friend or a relative or a significant other who has PTSD and interested in this, by all means. I mean, we know that actually the cannabis is the only effective treatment for trauma in terms of sort of a chemical. Why? Well, because our own system regulates trauma by making our own cannabis. So the only way we control our own traumatic effects or events is through initiation of endocannabinoid signaling, and then a lot of things happen after that initial response to the trauma triggering of the cannabinoid system. You have a whole regulatory structure that fixes what happens. And so exogenous cannabinoids, like whether you take it orally or inhaled, has in sort of unofficially, particularly among the veterans, has probably been the by far most effective modality. And there's been a talk about trying to sort of figure out how to legalize some of the PTSD treatments, whether it's MDMA or cannabis. Unfortunately, we haven't really moved far. FDA just recently shut down MDMA for PTSD, which was very upsetting, I think, and inappropriately. But that's a separate conversation. But I'm so excited you're doing this. So you guys want a lot of patients. I think any observational study would benefit from big group. I mean, that's how you get the
Yeah, we really
true
a
result.
lot of people. Another thing just for you to keep in mind as a provider is in this app, as a provider, I don't think that part is free, but you can sign up and then you can group all your patients together and you can get their data through the app, so that you can access and you can follow the trends rather than them just trying to tell you about it all the time, which is really helpful. So, I've put together, like I have a group of moms that I work with that have children with autism and epilepsy, and we have a little group there. So I can communicate with them sort of in a grouping. It's just it's easy, and again, just a great way to capture data, because cannabinoids are wonderful. It's really important to support your endocannabinoid system, and the journaling, the tracking, the keeping records is such a big responsibility for patients, and so important because we don't really have a lot of regulation and consistency in products. So it's really important to journal in some way, to keep record in some way, and it's just an easy way to do it. And I don't have any ownership in that company. This is not a plug because I make money off of it. It just really is a good thing.
Maybe
Yeah,
I've heard of something similar. I've heard of something similar. I don't know if it's this particular, but it makes a lot of sense. I mean, millions of people are using. We need some kind of automated data collection structure to sort of understand better and better. Well, wonderful, Laura. Thanks so much for being here. This is all we have for today. I think we have so much more to talk about. Maybe we'll come back in a couple of months and bring you talk about something else. Maybe we'll talk a little bit about as the study ongoing, like what are you guys preliminary seeing? So that would be really interesting. Everybody have a wonderful day. Stay tuned, subscribe. If you're interested in sort of staying up to date on all things integrated medicine, you see we're covering broad topics. And again, it was wonderful to have nurse Laura with us today, talking about cannabis, psychedelics, and her recent study. All the things she talked about will be in the links. So check it out in the descriptions to the video, and we'll see you soon. Have a wonderful day, everybody. Bye. Thank you, Laura.